April edition of Ask the Dietitian. I'm your dietitian, Lori Bumbaco. I'm an oncology dietitian. I work at Cancer Wellness Center. If you are interested, check out the website, follow Cancer Wellness Center on social media, subscribe to the YouTube channel that we have. There's lots of different programs related to nutrition and healthy eating that I'm involved with. I do individual consultations. So if you're interested to learn more, do any of the or all of the above. But this program, Ask the Dietitian, is really special because we pick a topic, but we allow our participants to ask me any of the questions that they have related to the topic. And so if you're new to this, have no fear. We record basically everything that I do, and it's all on the YouTube channel. So we've been doing Ask the Dietitian now for several years, and we have some really great topics in that collection of videos. So at your own leisure, please give it a shot. Take a look at it. I am really excited today because it happens to be one of my favorite topics. It's all about gut health, and I'm going to tell you why I like this topic specifically in just a few moments. If you're joining us on Facebook, thanks for being here. Really happy to see you. If you're looking for just simple but trustworthy advice about nutrition specific to oncology, you've come to the right place because that's my job to give all of you. If you register for any of my programs, you have access to the materials. So sometimes that's incentive to register ahead of time because sometimes I share even more than just the content. I share more than that, lots of different resources or recipes or other things that might help translate all of this science that I'm going to share with you into real life. So for Ask the Dietitian, I have a PowerPoint that I put together, and I'm going to share my screen and do that with you all. So thanks for being here, and I hope you enjoy this informative session, Ask the Dietitian. It's all about gut health. Thanks again for being here. Okay, so this typically is a popular topic when I'm in practice, like especially over the past several years, I've had a lot of people ask me questions related to gut health. And I think that's for good reason, and I support that because, digestion is sort of crucial, right? Especially as it relates to nutrition. It's really like this miracle. We take food and we eat and digest it, and we obtain nutrition thanks to healthy digestion. So it stands to reason most people want to make sure that their digestive system is working and functioning at its best, right? So a lot of times, however, we know that cancer and the treatments used for cancer can disrupt the function of the digestive system. So very often that is a component of what people consult me for in practice, and I'm really happy to kind of navigate that. But everyone is so unique, and it's really important to point that out as we move through the slides today. You're going to see that I kind of go back to that point that we're all unique. We all definitely have a complex medical history, but also our cancer and our treatment. And then also what foods we eat and our reactions to and our intolerances to foods, and not only just what foods, but how much and when we're eating them. All of this matters. And working with a dietitian ultimately is the best way to find some solutions that you might be looking for. Today, for the sake of our presentation, I'm going to keep things kind of general, right? But I hope that you will still find some helpful tips with some of the answers that I'm able to provide. Okay, so, and that's just a nice little overview of the digestive system. I can probably spend days talking about each component of the digestive system, but it's really something that's fascinating if you think about it, especially what's happening lower in the digestive system in the gut, and especially in the large intestine where we have a microbiome and we have these trillions of different microorganisms that interact with the rest of our body in a lot of ways, but probably most importantly in supporting our immune function. So that's relevant for oncology. We don't really get into that too much today, but I have spoken about it in past Ask the Dietitian. So if you're curious to know more, of course, you can always ask a question or submit that as a topic of choice moving forward for Ask the Dietitian. Okay, so on the agenda today, what I want to first do is just give an overview of what gut health is, if we can really attempt to even define what that means. And then I'm going to go into the questions that were submitted. We only had a handful today, so I really like to elaborate when I can on the questions that are being asked to give the best answers possible. And then just provide some resources along the way. I think there's some really fantastic ones that I've discovered. Usually when I prepare for programs, I learn about things and I like to pass that along to you, my audience. All right, so gut health. What is gut? How do we define gut health, right? Well, technically, there is not a widely accepted definition of how to define gut health, but according to the International Scientific Association of Probiotics and Prebiotics, this is sort of the working definition, a state of normal gastrointestinal function without active gastrointestinal disease or gut-related symptoms that affect quality of life. It seems reasonable that gut health would refer to the absence of bowel diseases and acute or even mild symptoms localized to the digestive tract. So really good examples of those symptoms would be a food intolerance, abdominal pain, nausea, flatulence, bloating, constipation, and diarrhea. That sounds like what a lot of my patients who are receiving treatment for their cancer, that they're navigating some of those symptoms, some or even all of those, right, at times. So for today's Ask the Dietitian, I'm really defining it this way, sort of like the approaching how to manage those symptoms. That's how we want to define gut health for today. If you go online, if you follow anyone on social media, if you're like on Instagram or TikTok or YouTube, you might see other people, and I'm not even going to call them healthcare professionals because they're probably not. Let's just call them influencers. They may be defining gut health differently. And there really lacks a scientific basis for that. And I could probably do a whole Ask the Dietitian on that too. But for today, just want to give you that perspective. Okay, so diets, as we know, they intersect not only with our physical well-being and our health, but also emotional and mental. And that's a lot of the work that I'm fortunate to be able to do at Cancer Wellness Center. And probably a great topic is how does our digestive system relate to our emotional and mental state, which would be a great topic in the future, I think. But we're not going to really dive too deep into that today. Our lives, if you think about it, not only do we think, some people ask me for like meal plans, like what can I eat for breakfast? What should I eat for lunch and dinner? When should I eat? But we also think about how we eat, right? And why we eat. So there are social interactions that are had, right? A dinner is a great example. And all of these decisions are affected by a lot of things. And that's exactly what a dietitian does in practice is help work on this with individuals. We also connect deeply with our gut, right? So most of you may be familiar with this. We can identify hunger because we might be hangry, or we can identify being full or just satiated enough, or certainly if we've had some coffee in the morning or an alcoholic beverage, we react, right? We know these sensations, and that's all thanks to our gut and a gut that's working well. Our intestinal environment, I alluded to this just last slide. It's, there's this intestinal microbiome as well as the mucosal layer. That's like that fine, really thin layer that lines our small and our large intestine. And if we're having any complaints or disease, we will probably know about it. But what is being explored in the science is sometimes the absence of disease doesn't mean that the gut is functioning best. So I'm just kind of throwing that out there because there's sort of this gray area. And that's a good opportunity for me to share that, if you want to know more, if you have a hunch that something's not quite right, just talk to your healthcare provider. You can always ask for a referral to a gastroenterologist and just try to explore that a little deeper. Okay, so let's get to those questions. That's probably why you're all here. Again, thank you for being here. So I'm going to start with this one because it's like so common with what I do in practice. How do I fix my gut during or after chemotherapy? My good bugs are being affected. I love that somebody knows that. All right, so how do we really fix the gut? Well, I came across this idea and I'm like using it from now on. I'm totally borrowing it. It's not a medical term. It's not like what we learn in school, but chemo belly is a phrase that's used by some, and now myself included, to describe like the effects of chemo on the gut, right? So all of those side effects and those symptoms. So the most common ones are nausea, vomiting, diarrhea, mouth sores, loss of an appetite, or abdominal bloating. Let's just think chemo belly encompasses one or all of those things, right? Which symptoms a patient experiences depends on so many things. Not only the type of the chemo, but the dose of the chemo. Sometimes chemos are reduced, sometimes they're modified and adjusted. So really it really all depends. And knowing what you might experience, it really begs the question to your oncologist and the team. Issues like stomach bloating may last on average for like a year, up to a year and a half after treatment is ending. And I can endorse that. People that I've worked with certainly have experienced that. And it requires a little bit of patience, but knowing that time is your friend in terms of gut healing and recovery. Some patients experience symptoms of what we call, now we're calling chemo belly, for even longer, but some even see it resolve sooner. So up to maybe a year, they start to notice some changes and some improvement. So just putting that into context for you. So if you're struggling post chemo and you're like, it's been 9 months and I'm still not much better, it's good to know that it may take some time. Okay. So being proactive about treating symptoms is so crucial. I can't emphasize that enough. I think don't suffer in silence. If you notice that you're having nausea or diarrhea related to chemo, talk to your healthcare team. There are so many tricks up their sleeve for how to manage that. And management is so important because it just prevents it from snowballing and getting worse. I think in general, what makes the most sense is that the gut is stressed, right? There's a lot of stress happening. So how do we sort of take things down a little bit, quiet things down? So eating slowly, which is not always an easy change because eating is such an ingrained habit, it's sort of automatic. So eating slowly, taking your time, avoiding carbonated beverages, avoiding straws. This is especially helpful if someone has some bloating. Eating smaller portions and eating every so often. We can help digestion by simply taking a walk after a meal. And I encourage this for almost everyone I work with, just a little walk. It's amazing how that can really help tell the belly, hey, you got some work to do, but not overwork it, right? So it just encourages this gentle digestion. Certainly, herbal teas can be explored. There are some contraindications sometimes for some of these teas, but peppermint, ginger, fennel, chamomile, they come to mind. And they're certainly widely available to us. If we can enjoy that, again, that sort of calms things down. You see what I'm doing there? So that may help if the gut is a little upset. And certainly avoiding some of those things that we know to be problematic, like alcohol and tobacco, and eating foods that support a well-functioning gut. I'm going to talk about that next. Okay, so what we eat influences the abundance and the activity of the microbes that live in our gut. So this is, I think, especially important post-treatment when you might be better able to tolerate these types of foods that I'm going to ask you to include. So if you are years post-treatment, I want you to try this. Try to eat a high fiber diet. So we're talking 30 grams or more per day. And now keep this in mind. Most of us Americans are consuming maybe 10 grams of fiber per day. So we want to go about this in a more strategic way and just have small amounts gradually over time because a lot of fiber all at once is definitely going to cause more bloating and discomfort in the gut. So we're going to strive towards that 30 by incrementally adding small amounts of fiber. And along with it, making sure we're drinking plenty of water in order to help our gut tolerate that amount of fiber. So where do we find fiber in foods? These are things that you've heard me recommend basically every time I speak. So legumes like beans and lentils and split peas, our nuts and our seeds, our whole grains, especially bran, fruit, our non-starchy vegetables, those are the highest in fiber. This is why very often a plant-based diet is beneficial, but certainly beneficial for the gut and for gut diversity and for recovery if you've been subjected to some treatments or surgery or heavy duty antibiotics that have really disrupted your gut microbiome. Probiotics, those are live microorganisms that are present in some of our fermented foods. So the most popular one that Americans consume is yogurt, but there's also a great option of kefir on the market. Some kefirs are better than others. Some have a lot of sugar. Some are just plain, and you can add some sugar too. There's lots of options. This is where a dietitian gets helpful. Kombucha, miso, and fresh sauerkraut or fresh fermented vegetables. So we're talking about the ones that are refrigerated. They're more likely to contain some live active cultures compared to the pasteurized ones that are shelf stable, because that will render those cultures less active, right? Because they've been pasteurized. Prebiotics, if you haven't heard of that term, I'm introducing it to you today. Those are special, specific fibers that serve as a fuel for the microbes, but especially the beneficial gut microbes. And we find them highest in garlic and onion and leeks, as well as wheat bran and soybean. It's also in sunchokes, if you happen to find that. So we want to eat both probiotic foods and prebiotics daily, because they are going to help support the gut daily. They don't change what's happening in terms of the microbes in the gut. They're just visiting. So because they visit, they're going to leave, right? Hopefully. They're those types of house guests. So they're going to come in and then they're going to leave. And that's why we want to make sure we regularly consume them. And a whole food plant-based diet encompasses a variety of these choices, right? So that's where a lot of times I explore diversity with people that I'm working with. Hopefully that helped answer that question. Okay, next question. How do I navigate that? I feel better holistically and should eat a lot of fiber, right? This is a good follow-up question. After colorectal cancer, it seems to have messed up my system too much. What's the balance? What healthy foods will help me achieve that balance? So if you've been eating low fiber diet to deal with side effects, it's gonna take time. There's gonna be a transition. And I want you to think about this as like a reintroduction, right? So here's where there is definitely a strategy to be employed. It's going to take time. It's going to potentially take almost 2 months to reintroduce some of these foods because they haven't been there for a long time, and the gut needs to be reintroduced slowly to these new foods, to these new to you foods, right? So consider trying one new food at a time and change nothing else. Introduce that new food, especially the one that you feel ready to do. Give it a day or two, maybe 3, and eat that new food alongside foods that you already feel confident about your gut tolerance with, right? And then check back in a couple days. How did it go? And then you'll know, okay, maybe I can try that again. And the amount you take may also matter. So maybe start with a small amount, or maybe you feel confident. I'm going to try this new food at a regular size portion. Some people drop it down to half size portions or quarter amount. And basically, they're just assessing how their gut tolerates that new food. The key, I think, in my practice, I've noticed that whatever it is that the person wants to try, that's the one to go with, right? So there may be a list of foods that I recommend for you, but what do you feel comfortable doing? That's the one to go with, because that gut instinct, there's a reason why they call it a gut instinct. Chances are it's going to serve you and it's going to work out just well. Okay. I would say if you're someone who's savvy or wants to know numbers, 5 grams of fiber at a time is like the max. I wouldn't go any higher than that. Like 3 grams of fiber is a good source of fiber. 5 is excellent. So if you feel comfortable and you want to go up to 5, cool, but no more than that, because that's a lot. Okay, so you might read labels now and you might see something like a gram of fiber or 10 grams of fiber. Now you can put that into context. 3 is good, right? 3 is a really good amount of fiber, and that may be your limit. A lot of times people, and this is going up to the previous bullet point of sort of like anchoring your tolerated food alongside your new food. So let's just say you want to try a bean pasta or a whole wheat pasta. Mix it in with the anchor food, the things like white pasta, which you know you already do fine with. Rice is another great example. We know white rice is generally well tolerated. Maybe you want to try a little bit of brown rice or a little bit of white rice with that. You can even mix different grains in, like quinoa, with that anchor food of that white rice or that white pasta, because you know you're going to do okay with that. And it gives you some gut support, but also some confidence. And then maybe transition over time where now you're eating more quinoa or more brown rice than you are the white rice or the white pasta. If your symptoms return, just step back down the staircase, right? Think of it that way. That's a great analogy. Step up the staircase, step back down, or stay on the same step if you need to, right? And just give it time. And again, it's that gut check-in, that gut instinct of like, what am I ready for? Okay. And this is actually a great opportunity to work with a dietitian on something like this. So generally speaking, sometimes people are like, but I want to eat that fiber. There are foods with different types of fiber in them. And it turns out that there's a type of fiber that our gut likes the best when it's upset and irritated. And generally speaking, those are soluble fibers. So soluble fibers, in terms of its texture and consistency, they're a little bit softer and they're a little bit more gel-like. So they travel through the digestive tract and they're much more gentle compared to the roughage type of fiber that we call that insoluble fiber. So I'm going to give you that list here. Boom. Okay, so oats are a really great example. Again, mixing that white with that brown rice. As soon as we cook our vegetables, but especially root vegetables like carrots and sweet potatoes, that's a great source of fiber, and it's a vegetable. Same with our asparagus tips. They generally are what I recommend for individuals who have diarrhea and who are looking to kind of expand on their choices. They don't want to eat the same old foods. These are generally going to be tolerated. Our peeled fruits like banana, but also applesauce is a great example, avocado, melon, they're all technically botanically fruits with fiber. But again, that type of fiber that's going to be better tolerated. And so great nutrition here, right? So as soon as we cook foods, it's going to soften the natural fibers that are present in them. So it makes them softer and easier to digest than if we have them raw. Okay. So sometimes people have experimented with that too. They'll like maybe not boil their carrots, but they'll steam them. So they'll use a cooking method and then maybe pair it with like some raw carrots just to see, like, can I handle a little bit of this? Again, you can see where you get to decide based on your own individual tolerance what's going to be best. Start slow. I can't emphasize that enough. And then increase slowly to avoid bloating and discomfort. And as I mentioned earlier, lots of water, lots and lots and lots of water because you're incrementally adding more fiber. Your system needs some help and some support with that. And the thing that does it is actually water. So more and more water. Now, a lot of individuals I work with do well with food journaling. So this is just one example. This is from Stanford, actually, and it's like a digestive health food journal. And so you see a really great example here. You're going to get these slides so you can use this one yourself. But there's even ones that you can buy. Like it gets really fancy. So it's totally up to you. But the idea here is to try to be pretty specific about when you're eating, what you're eating, and how much, and also what you're drinking. And then you can identify any symptoms related to that. Sometimes people will make an additional column and they'll put what else is happening in their life. Like maybe they have a CAT scan coming up. And maybe all of a sudden they notice they have a little bit more diarrhea, or their appetite goes down, or they didn't get a good night's sleep. I think helping really identify as many variables as possible to know what is the concern, what's the issue here. But what's great about a food journal is that it's giving you like real-time data, real great insight. Someone like a dietitian can review that with you. Your healthcare provider may welcome this as well to help to identify what's the pattern here. I think most importantly, it can identify what are the solutions. So if you can start to also, maybe that's another column, this meal really worked well, or this food in this meal really worked well. And I think that that's what I need to do more often going forward. Okay, so hopefully that'll be a helpful tip for you as well. Okay. Would you please explain irritable bowel syndrome? I'm going to do my best. This is the dietitian's version. Okay, so irritable bowel syndrome is a functional bowel disorder in which abdominal pain or discomfort is associated with defecation and or a change in bowel habit. Abdominal pain and abdominal bowel habits include constipation, diarrhea, or, believe it or not, a mixture of both of them, so constipation and diarrhea, are the key features, right? So you may even hear IBS with constipation, IBS with diarrhea, or IBS mixed IBS. They further classify it that way. Our gut and our brain are very closely connected. And I did not know this, but they develop from the same tissue before birth. That's wild. So because they share the same tissue, they share very similar functions and activity, right? So as it turns out, both our gut and our brain share chemical messengers, and a great example is serotonin, but they're also linked by many, many nerves. So where we're at with managing IBS is it's just opened up a lot of doors because of that understanding. And some of the things that we do to manage some of our mental health issues are the same that we use to manage our gut health issues, which is really kind of exciting, right? This is relatively new since I've been in practice, but a game changer for a lot of people I work with. Now, if you're curious, like, do I have IBS or not? I want you to go to this website, gi.org. They actually have a screening tool that you might find really helpful. You can take the screener, again, bring it to your healthcare provider and say, this is what I found, help. Could you help me explain it or interpret what I'm seeing? So the next few slides are going to be images that I find really helpful to help kind of, I like infographics, so you can kind of take away from this some of the causes of IBS we don't technically know, but again, you might think, you might see some of these and it might trigger you to think, oh, this is me, I have had an infection, or I've have a sensitivity, I have a sensitive gut, like I've had people share that with me. Or gut motility is altered, it's off. And so certainly treatment can impact gut motility. We know that. So sometimes people have a baseline dysmotility and then treatment just exacerbates that, right? So it's worthy of revisiting what your baseline was and the impact that treatment might have had on you. This is a little bit more from the American College of Gastroenterology. That's the gi.org website that I shared earlier. Really great tools on their right off of their website. IBS is highly prevalent, I would say, like up to 15% from what we understand. So that's 3 in 20 people. The number one symptom is pain. We know that it reduces quality of life significantly. It's adding to our healthcare costs. A majority of those who have IBS would give up to 10 to 15 years of life expectancy for an instant cure for their condition. So speaking of quality of life, I can't see a better example of that. It's not just found in women, it's like an equal opportunity disease, right? Or disorder. It impacts everyone, right? So it doesn't discriminate. And as I mentioned earlier, it's considered a disorder of the gut and the brain interaction. So wild, right? And as I shared, there's different types of IBS, and bloating is also a common symptom of IBS. Now, there's hope, right? There's hope. There's lots that you can do. Working with a dietitian, I would say, if you get confirmation that you have IBS, ask for a referral to a dietitian because there's no question a dietitian can help you, and there's a lot of strategies to explore. There's over-the-counter products. Sometimes people take prescriptions, and there's gut-directed therapies, as you can imagine, because of the interaction with the brain and the mind. There's cognitive behavior therapy that's been like proven to be an effective treatment, and also hypnotherapy. Really wild, but really effective. Don't suffer in silence. You can learn more. There's lots of information here for you to see. Okay. So if anyone in the audience is concerned about that, hopefully this is a great resource for you. Okay. Next question. Is magnesium glycinate better than magnesium citrate? I believe the citrate causes diarrhea, but the glycinate does not. I know this is not food related, but just wondering if you have any input on this. Well, I'm going to bring it back to food because I have to. But great question. So magnesium itself, it's an essential mineral. It serves as a cofactor for hundreds, like 300 different enzymes that help our body function. So this is just a handful of what magnesium is involved with, and so therefore an essential. Essential meaning we need to make sure we're getting enough through our diet. It harnesses energy from the food we eat. It helps us synthesize RNA and DNA and even proteins. It's structural. So it helps support our skeletal system, but it also helps make up components of our cells, our chromosomes. It sends signals. It's like a messenger. And it also is a transporter. It transports electrolytes to help our nerves, our muscles, our heartbeat. Really important. So a deficiency of magnesium is rare, unless you, and I'm going to give some examples in the next point, but it's rare. So if you're eating a pretty balanced diet, there's always room for improvement, right? And you are quote unquote mostly healthy, especially with your digestive system, chances are you're okay. All right. However, you may be at risk for a magnesium deficiency if you have prolonged diarrhea. So that certainly happens for some people I work with on treatment. If you have IBD, so that's not IBS, but that's inflammatory bowel disease. So that encompasses both Crohn's and ulcerative colitis. So anyone that comes to me that has one of those conditions, I'm automatically like magnesium is on the list of something that I want to make sure that person has adequate amounts of. But also celiac disease, long-term diabetes, and also certain diuretics can cause us to lose some extra magnesium. A little bit more about magnesium. The recommended dietary allowance is 420 milligrams for men and 320 for women. That amount is the lowest amount required to prevent a deficiency. Okay, so good to know, but there's a lot of debate and a lot of argument that this may not be the optimal amount, right? Because what if we need more in order to optimize our health, maybe even reduce some of our chronic diseases? Is that the right number to go off of? Maybe that number needs to be higher. Interesting argument. We don't know yet from the data. Okay, so most Americans roughly consume, men on average, I guess because they eat more, right? 339 milligrams, whereas women consume on average about 269 milligrams a day. It is considered a shortfall nutrient. So now on food labels, if you look at the nutrition facts panel, you may discover that magnesium is listed to see if your food choice has some magnesium in it. Good to know. But healthcare providers, public health experts, they're starting to look at could we add more magnesium and make sure that Americans are getting enough magnesium. Now, unfortunately, there are no reliable markers of magnesium. It's not like if you get blood work that the magnesium that level in your blood work is determining if you have optimal levels in your body, unfortunately. That's because most of the magnesium in our body is not in our blood. It's in the other compartments in our body. So when we take it from the blood, it's not truly representing what totally is happening overall in our body. Hopefully I'm explaining that okay. We find magnesium in green leafy vegetables, unrefined whole grains, and nuts. Those are really the best sources. So specifically Brazil nuts, oat bran, cashews, spinach, almonds, Swiss chard, shredded wheat, and my favorite, there's a little sarcasm here, lima beans, not my favorite. But if we can eat more of these foods, if you're looking to increase your dietary intake, that's a great opportunity. All right, so what about supplements? Because that's what the question was asking. So there's a lot of supplements on the market with different salts using magnesium attached to a salt. So magnesium oxide, hydroxide, gluconate, chloride, and citrate. Those are all salts. But they also combine sometimes magnesium with amino acid chelates like magnesium aspartate. So depending on what product you pick up, you may see something different and certainly in a different amount. So I'm going to go through like all the different types just to give you a better understanding of how well they're absorbed and then if they cause any side effects too, because there's so many products on the market to decide. Okay, so, and mag is short for magnesium. So mag citrate is the most common. That's the one, if you pick up 10 magnesium supplements, probably 9 times out of 10, it's a magnesium citrate. It's the most common. It's very highly bioavailable, meaning our body gets a lot from the supplement. Sometimes supplements don't give us 100%. Sometimes supplements give us 100%. They often use mag citrate to treat constipation. Okay, good to know. So if you do not have constipation and you're taking mag citrate, it's probably going to make you loose. It's probably going to cause some diarrhea. Okay, so hopefully that's answering that question right off the bat. Mag oxide is not very well absorbed. We do use it to treat both heartburn and constipation. Again, if you're looking at products and you see an oxide, because you're like, I'm not going to do the citrate because that causes diarrhea, you also don't want to choose the oxide either, right? Mag chloride is easily absorbed, used to treat heartburn and constipation very similarly. Okay, so put that one on the list as a no as well. If I'm not constipated, I don't need these. It's going to make me have diarrhea. Magnesium lactate is more easily absorbed and more gentle to the digestive system. So sometimes the go-to as a product. Magnesium malate is easily absorbed, has typically less of a laxative effect. Mactorate supports healthy blood sugar. So if that's something you're concerned about, or blood pressure, research has supported that type of magnesium supplement may help in that. Magnesium L-threonate is easily absorbed and most effective to increase magnesium in the brain. So sometimes mental health providers who work closely with dietitians may suggest that product or a product containing that. Magnesium sulfate is commonly referred to as Epsom salt, and so helps sore muscles. Not when it's taken orally, but soaking your legs in a water soak with Epsom salt could be helpful. And glycinate is easily absorbed and shown to reduce stress and anxiety, so sometimes a good go-to as well, but also less likely to cause diarrhea or does not have a laxative effect. So again, to answer that question directly, the glycinate is typically a good choice as well, okay, compared to especially the mag citrate. It's important to point this out, magnesium supplements can interact with prescriptions, so antibiotics and some other drugs like those that treat nerve pain, like gabapentin is a common one, Parkinson's disease, and some of our anticoagulants. So bottom line here is if you think you need a supplement or you were told to take one from your healthcare team, chances are that all was checked out and just take one, right? But now you know if you're looking for targeted choices to minimize GI side effects, or if you're looking to tap into something else like blood sugar support or stress and anxiety support, you might want to look at a different formulation. If you're just out there and thinking, I want to take a magnesium supplement because I heard on TikTok I should, or I heard it's popular, my friend at the salon recommended it, go to your healthcare provider, just double check first. You want to also think about the pharmacology of everything, and you could talk to a pharmacist or your healthcare provider to make sure there's no interactions if you're taking some prescription medications, okay? So just double check all of those items as well. And here's your list of food sources of magnesium, just in case you want to listen to the dietitian and think about ways with health in mind, because all of these choices on this list are going to be healthy. They give you magnesium plus, they give you a lot more to offer, right? So just some of the top choices on there. And if you're looking for an excuse to have some chocolate, there's some dark chocolate on the list. Okay, our last question for today. Would you like to talk, or would I like to? I added that in there. Could you see? Could you tell? Of course I would. Would you talk about Streptococcus thermophilus? Is it a good probiotic to take? It seems to be in most yogurts, and thank you. Great question. Okay. So Streptococcus thermophilus is a gram-positive bacterium widely used in dairy fermentation. So they make yogurt and some cheeses using this bacteria. Gram-positive, as it turns out, is just classified based on the fact that it's the color that it turns when they stain it. So like pathologists, when they're like putting their stains in the cells and they're looking at the bacteria, I think it picks up a purple color, which is probably really pretty. But that's really the definition of gram-positive, just so you know. Now in 2010, so not too long ago, they discovered that it was thanks to Streptococcus thermophilus, it's responsible for those who have a lactose intolerance to be able to digest yogurt without any digestive complaints. It's like, thank you, Streptococcus. This is a good thing. And that's because of their enzymatic activity. They basically have an enzyme that helps break down the lactose in yogurt. So as it's culturing it, this is the outcome. So some people with a lactose intolerance, they do just fine with yogurt, but especially a yogurt that's been cultured with this bacteria. It has antimicrobial properties, so really great. It kills pathogens and things that don't belong in our body. So good reason to look for it in yogurt. Now, in terms of taking it as a probiotic, because I think this is what the question was asking, we don't really know. Okay, so the reason, and I could do a whole Ask the Dietitian on probiotics. We don't really know. So probiotics are recommended if you have a specific condition in which that specific probiotic showed it was beneficial. So there's lots of different probiotic strains, lots of different dosages of these probiotic strains. And I don't want you to just haphazardly take a probiotic unless you have a condition and you're matching the right probiotic to help manage that condition. Okay. But as it turns out, with Streptococcus thermophilus, they are looking at it in terms of a probiotic to help manage some conditions like antibiotic associated diarrhea, IBD, that's that Crohn's and that ulcerative colitis, and then some of our infections like H. pylori. And the way that it works is that it helps modulate the microbiota that lives in our gut, and it helps maintain immune homeostasis. And that means just kind of maintaining status quo. That's how it works. And so they know that, but they just need to like confirm it, and formulate products, have people who have any of these conditions take these products and then follow them to see if it benefits them in the end. So if you are asking this question, should I take a Streptococcus thermophilus as a probiotic, and you also aren't dealing with any of these conditions, it might be worth exploring. Again, another great question for your healthcare provider. If you have a gastroenterologist in your life, I would certainly pose that question to him or her, because chances are they're managing you for one of these conditions anyway. So the probiotics are not the standard of care, but it might be like an adjunct to the treatment that the physician is offering for you. Okay. Hopefully that helps you. Now you see there that image of live active cultures. I didn't mention that earlier. Look for that on your yogurts. That's like a guarantee that your yogurt has some live active cultures. And then any other fermented dairy products like kefir is a good example. Okay. Enjoy yogurt too at the end of the day. Right. So you're asking about supplements, but I encourage you to continue to eat those yogurts if you see them. Okay, so just to share some resources, this is from the NIH. It's really kind of interesting if you're looking more into how our digestive system works. The Canadian Society of Intestinal Research, badgut.org, it's really comprehensive and a lot of great resources if you're just kind of looking to figure out what's going on. If you're just looking to learn more, but also specifically about some of our digestive diseases. And then more about IBS. So I really love that gi.org website that's in the slides earlier, but Monash really has this fantastic resource about IBS. There is a diet called low FODMAP that is proven in research to clinically help with determining which foods are problematic for someone struggling with IBS. I would recommend that you only work with a dietitian to use a low FODMAP diet. It's meant to be a temporary elimination diet, not a long-term plan. Okay, so it can be very restrictive, and I want you to work with someone who knows what they're doing, and rather than navigating that blindly. So our next Ask the Dietitian is on salt. One of my all of the topics are my favorite. So please join us May 1st at 1 o'clock, first Friday of the month, and I'm going to end my share here. Thanks for staying on longer than expected. And hopefully I answered a lot of your questions all about gut health this month.